Hi guys! I'm really sorry na it's been I think almost 2 weeks na since I've posted a video about nursing, and there's a lot of questions and some requests for me to do. So eto na, babawi na ako sa inyo. I've got a comment from JA and he is asking for me to do a video about what a nurse here in New Zealand do. I'll be sharing my experience, of course, because I'm an orthopedic nurse in Mercy Ascot Hospital and it's a private hospital. So my experience could be different from public sector or the government hospitals or the DHBs because they tend to cater acute cases and more complicated cases. In our hospital, it's mostly elective, so it's very seldom for us to be taking care of, really heavy patients or complicated cases. That's the difference, one of the difference of working in a private hospital and a public hospital. For now, I'll be discussing what I do as an orthopedic nurse here in New Zealand. First of all, if you're coming in the morning shift, of course, you're gonna get handover from the night staff. We have a handover sheet where we could see the diagnosis, the biographical data, the things to do for that patient. And it also includes the name of the surgeon and the anesthetist. Very useful, I could say, because it makes handover faster and easier as well. The next thing you'll do is check the patient's charts. Check when was the last set of OBS or vital signs was done, and then you're going to check the medications due. So you'll be having this shift planner where you're gonna write those medications and OBS to be done, or if you've assessed something new or something important that you need to hand over to the next shift. It's very organized. I mean, our hospital is very organized about things because we are using this application called Trend Care, and this Trend Care helps nurses to actualize how much time you need to spend to this patient. For example, sa previous experience ko, sa itong bay na to, sa itong bay na to, sa itong bay na to, which is this bay has 6 full care patients, and then this bay has 6 independent patients, and then this bay has 3 independent and 3 full care patients. So it's unfair, and kawawa tong bay na to, which is lagi kong nakukuha noon. Yeah, pagod na pagod ako. It's a good application, and hopefully most hospital should use this because it would help nurses not to be overworked. So in Trend Care, you could actually use it to put in your nursing notes for the next shift to read during handover. So I could show you an example of our handover sheet. So hindi natin isasama yung name. Nursing notes, ito yung diagnosis, then sa other side, nandito yung patient details and yung doctor's name and the room number. This is our planner. It's very helpful. So you just put in the time. If there's any medication due, lalagay mo dito. Then if you have monitoring, especially for post-op patients, you could put in the OBS para hindi ka lagi dala-dala mo yung chart. But next year will probably be digital, so hopefully mas better yon at mas maging efficient yung system. After checking the medical notes, updating the Trend Care, the next thing to do is give them their medications. Of course, their regular medications. Usually, hindi ganun ka-complex yung mga medications dito. So, most of the time, binibigyan na lang namin medications is for pain relief. That's our main goal, to make patients comfortable after their surgery, because orthopedic procedures are very painful, I think. If the oral tablets or the oral pain reliefs are not working, that's the time when you could, give them IV medications. And most of the time, patients comes in with PCA and PCEA. So PCA is patient-controlled analgesias, and then PCEA is patient-controlled epidural analgesias. Mas madali hawakan yung mga PCA na patients kaysa sa PCEA Sa PCEA, you need to check the block levels, you need to check the bromage, you should do your neurovascular assessment as well. So there's so many things to do with a PCEA patient compared to a PCA patient. So after checking the medications and giving it to them, you could get a patient for discharge. So for a patient going home, we use this application called Zido. It's very useful. You just need to type in, the details. Then you just need to type the discharge instructions, when will be the follow-up checkup, how to take care of the wound, what to do if you're constipated, what to do if these symptoms occur, and also when was the last medications taken, what are the medications you're going to take at home. Those are the things you need to put in your discharge summary. You could also get a patient from theater, so a post-op patient. When you're getting a patient from the recovery room, the PACO nurse would give a handover. And if you have questions, it's the best time to ask them during that handover. If you have questions about the medications, about the IV fluids, or something you're just concerned about. We don't really admit them. Usually it's the admissions unit that do all the paperwork. So when they come up from the theater or the operating room, we just put them in the room and just continue with the OBS monitoring. So I think that's a really good system, because it's really hard when you're gonna discharge a patient and then there's an admission and you still have to do all the paperwork. That's what I do before. Before you go, just make sure that you've given every medications with your nursing notes. Update the trend care again, of course, because you're going to hand over to the next shift. For an orthopedic patient or for any surgical patient, bowel movement is really important. Passing water or passing urine is very important as well, especially post-troc. Don't want the bladder to burst. Make sure you monitor the urine output and do some bladder scan if they haven't paid for the past 6 hours. We give regularly the pain reliefs like paracetamol, tramadol, and some anti-inflammatory medications like celecoxib. We don't want their pain to creep up to a level that it's very hard to pababain. We'll be with a physio when they are walking, just in case they become lightheaded. A vasovagal episode, because it's very common after the procedure. So it's a summary of what I do. If you want to learn more about what we do, or if you have any more questions, just leave a comment below and I'll try to answer every questions. And please don't forget to subscribe to my YouTube channel and like this video. So sa susunod ulit, I'll be doing another video about nursing. And thank you for watching. So see you soon, guys. Bye-bye.